Hi, welcome to our editorial preview for our Hospitals and Health Networks issue of August. And across the table for me is Bill Sanamore, Managing Editor of Hospitals and Health Networks magazine. I'm George Tefelsky, a producer here at HNHN Online. And Bill, give me an overview of our cover story, The Rising Risk Tide.
Okay, well, the cover story is about the fine line that hospitals are treading right now between fee-for-service payment system moving to a value-based payment system. So they're still working in two worlds, basically.
And one of the other things I read in the article, there's like two different things going on right now. There's accountable care strategy, and there's an accountable care organization.
Right.
What's the substantive difference between the two, or is there a difference?
Well, there is. Accountable care organization refers to basically the CMS regulation about accountable care, which most providers are unhappy with. So in the meantime, that's a pilot program that they can option into or out of. But in the meantime, most providers are going to accountable care, the concept of accountable care, where they're linking with other providers, physicians, et cetera, to prepare themselves for bundled payments and being paid for outcomes rather than based on per incident fees whenever a patient comes to see them.
Let's go on to the gatefold.
All right.
Now, the gatefold's about emergency department visits.
Right.
And give me an overview on that. There's a lot in there this time.
Right. Well, as everybody knows, emergency departments across the country are overcrowded. There's fewer of them than there used to be, and there's more patients going to the emergency departments. And one of the issues with the Affordable Care Act is that it's actually going to push more patients to go to the hospital for care because they're going to have coverage.
Okay.
So the gatefold really looks at ways that you can streamline getting patients through the emergency department. The ones that aren't appropriate, that don't have emergent conditions, can be sent elsewhere. How do you do that? The ones that are going to be admitted to an inpatient bed, where do you put them in the meantime so that you free up the emergency department? It's just we cover throughput and output and.
Yeah, there's very clear definitions there about input,
Right.
throughput, and output.
Right.
And
Solutions, how you can do it.
Right.
And they're not necessarily expensive.
And speaking of solutions, I mean, one of the things two things struck me. One thing was how emergency rooms will put sick patients in one area, less sick in another. This seemed to me to be kind of obvious. Hospitals are only getting to that now?
Well, they're learning.
Okay.
And they've learned to do that. And one of the ways to make the emergency department more efficient is to have, for instance, patients triaged immediately and sent to the appropriate area of the emergency department or other department. They're also trying to reach patients before they actually get to the emergency department.
Okay.
So that if it's not an emergent situation, they're going to an urgent care center or a primary care physician.
And that relieves stress off the... Hi, and welcome to another part of our editorial preview for the August issue of Hospitals and Health Networks magazine. I'm George Tefelsky, a producer here at HNHN Daily, and I'm joined by Matthew Weinstock this time, Senior Editor at Hospitals and Health Networks magazine, and we're going to talk about an article in this issue about the Most Wired winners for 2011.
Right, thanks, George. So the Most Wired program we've been doing for 13 years now, where we gauge the hospital field's use of information technology. So everything from clinical applications to back office applications, infrastructure, data recovery, that kind of stuff. The article in the August issue looks at our 2011 Most Wired Innovator Award winners. So the Innovator Awards are applications that a couple dozen hospitals submit to us voluntarily, where we gauge, and then we have a panel that gauges their use of IT in creative and innovative ways that promote healthcare and their services in the community. And so this year we had 3 winners and 3 finalists.
So tell us about the first one. They're all equal winners, right?
Correct, right.
Okay, so just pick one. Tell me about it.
Right, so one was Avera. They're in South Dakota. They're a rural hospital system. They've got 29 hospitals. And the program they won for was called e-pharmacy. So in 20 of their 29 hospitals, they now have this e-pharmacy program where pharmacists will put in orders electronically, and then all that information goes to a centralized location where it can be reviewed and approved by a pharmacist at that central location, and then sent back out to the facilities to do the dosing and get the right medications to the patient at the right time.
And another winner.
Right, so we had Baptist Health South Florida,
Okay.
and they won for a mobile app. So we know a lot of people nowadays carry around an
Sure.
iPod, iPad, a Droid. So what Baptist did was they created a mobile app where you can find the nearest Baptist Health South facility to you, and you can also see the door-to-doctor wait time. So if you're out, your kid slips, has an injury, you can get on your mobile device, find the nearest facility to you, find out exactly what the wait time is, and make sure you're going to the right place.
And finally, who's the last winner?
Yeah, our other winner is the University of Pittsburgh Medical Center, or UPMC, and they won for something called e-visits. So for a long time, healthcare sort of struggled with how do we use email and the internet to perhaps cut down on some of the actual visits to a doctor's office and hospital. And so they've developed a program where for 25 more or less routine conditions, a patient can put in all their information, their symptoms, their condition, and that information will go to their primary care doctor, and they're promised within 24 hours they'll get a response back. The average wait time is about 4 hours to get information back from your physician.
So these are people already enrolled. They have their primary care physician there, and they know who to contact.
Correct. They've got about 54,000 registered users for this site already.
Well, Matt, thanks for joining us today.
Thank you, George.